We are back. Goeiemôre, good morning. Recently, momager, media maven, and just all-round multimillionaire Kris Jenner was photographed looking years younger. Some say it's Photoshop, others speculate she's found the fountain of youth. And some credit a new surgical technique called the deep plane facelift. Today we have Professor Sofianos, an expert in plastic and reconstructive surgery, in the studio to tell us more. Welcome to Goeiemôre. Good morning, Dr. Chris.
Good morning. Thanks for having me.
First things first. Is Kris Jenner's new face real? Or is it AI? Or is it Photoshop?
Although in the world of AI, we can quickly jump to that. It is real. It's advanced techniques. The sort of advancing of plastic surgery, going from an overdone look to now a very natural look. And a lot of people not believing that she's actually as old as she is.
So what is this facelift exactly, and how does it differ from the traditional facelift?
So the traditional facelift, or all facelifts, start with an incision in front of the ear, go up into the hairline, and then behind the ear to lift up the neck. Then once we're beneath the skin, we then decide what to do with the deeper layers of the face. So before we just tighten this up with some stitches, nowadays in a deep plane facelift, we actually go underneath the connective tissue and lift it up together with the skin, so in a different direction, but giving a more natural lift than just the tightening of the skin previously. By tightening the skin previously, it would give this sort of overdone or windswept look, which is something that we're trying to avoid these days.
So what exactly is a deep plane facelift, and who's the ideal candidate for this in comparison to the original or more traditional facelift?
So all patients that would have been candidates for the traditional facelift are candidates for a deep plane facelift. The difference in a deep plane facelift is that while we're avoiding an overdone look, we're looking for patients that have objective signs of aging. So those objective signs of aging are some heaviness along the lower face, some heaviness in the neck. Yeah. So we can't say that it's a specific age. So we used to say people go for facelifts in their 50s or 60s. Nowadays, we've changed that, and we say if there's objective signs of aging, then you could qualify for a facelift. What's changed is that we're looking at patients individually rather than just having a set list of criteria and coming up with an overall surgical rejuvenation plan for them.
And since you are referring to age, I want to know, how does a deep plane facelift address signs of aging compared to other facelift techniques?
So we age in a number of layers. So we age at the skin level, we age in the connective tissue, and beneath the connective tissue we have fat. So with the new techniques, instead of just aiming to address the skin, we're addressing all the layers of the skin. So we're starting off by going beneath the skin, we then lifting up the connective tissue, which is the area which descends the most with regards to aging. We're lifting that up to a better position, we're vertically pulling it up. And that's the vertical restore part of the technique. So once we've put that descended connective tissue up in a better place, we then drape the skin lightly over. Instead of tightening the skin and having this tension or pulled look, we're putting all the tension beneath that. But as I said, it's a number of layers that we need to address. So with Kris Jenner, it's probably not just a deep plane facelift, but it's other things such as fat grafting. So that's injecting fat into areas that have deflated. So when we talk about aging, we talk about descent and deflation being loss of fat. And that's what I think she's had replaced as well in her face.
So is a deep plane facelift something that you should do if you've already had a traditional facelift, or can you jump straight into the deep plane pool?
Absolutely. You can jump straight into the deep plane pool. So we have a lot of patients that are coming through for the first time, exploring a facelift, and the deep plane facelift is the gold standard in facial rejuvenation. The benefit is if you've had one of the older techniques, the deeper layers of the face are essentially untouched. So you can have, although the risks are slightly increased with regards to skin and lifting up the skin, that virgin area beneath the connective tissue allows us to do a deep plane facelift, even in those patients that have had previous facelifts. So it's a good answer for both the new and older patients that have had previous procedures.
And the procedure specifically, how long does it take?
It takes about 3 to 4 hours. So that's, excluding going into theater, being put to sleep, waking up. So it's about 3 to 4 hours of actual operating time. And that's just the deep plane facelift component. If we're adding fat grafting, a blepharoplasty, which is an eyelid lift, that adds a bit of time to it. So ultimately, if we're doing a full facial rejuvenation, we could be in theater about 5 to 6 hours in total.
Wow.
Obviously, nothing is a magic bullet and everything comes with its own set of risks. What are some of the risks involved in a deep plane facelift procedure?
Absolutely. So when we talk about risks, we look at surgery risks and specific risks. So surgery risks, that's bleeding, infection, risks of anesthesia, although anesthesia is very safe these days. And if we look at the facelift specifically, because we're lifting up the skin or we're separating the skin from the deeper connective tissues, certain patients are at high risk, and those are patients that smoke, so we can't do this procedure in smokers. Patients that have other chronic comorbidities, we'd have to look at more specifically. So we have a risk of poor wound healing, where we incise or where we cut to lift up the skin. We have other risks of the actual wounds are closing up completely, bleeding, infection, as we said. And the biggest risk with regards to deep plane facelift is facial nerve injury. So the facial nerve is the nerve that supplies the motor part of the face. So that allows you to smile, open and close the eyelids, etc. And the body's quite smart in keeping these nerves beneath the connective tissue. And what we're doing in a deep plane facelift is we're actually going into that layer where the facial nerve lives. And for that, you need specific training. So deep plane facelift can't be done by just anyone. It's done by plastic surgeons. It's done by plastic surgeons with specific training in the technique. And other steps that we take in theatre is having a neurophysiologist in theatre that follows the nerve and allows us to stimulate different structures to make sure that we're not injuring the nerve. A lot of the time, just by operating close to the nerves, it does create a bit of swelling. So sometimes there is a bit of weakness in the face, but that tends to resolve with time.
And what is the typical recovery time?
So as with any surgical procedure, the wounds themselves should be closed at about 2 to 3 weeks. Especially with deeper tissue manipulation, we do expect some swelling and bruising that tends to settle over about 4 to 6 weeks. The final sort of swelling will be gone by about 3 to 6 months, but a final appearance, that's where the scars are flatter, lighter in color, that's up to a year post-op. Most patients do go back to work at about 3 to 4 weeks down the line, lighter activity even sooner, from about 10 to 14 days. But realistically, I tell all patients that we're looking at a year ahead. So even with Chris Jenner, I'm not sure she had it and then sort of appeared on the stage. There's always recovery associated with the procedure. And especially when we add things like fat grafting and other ancillary procedures, it does take a bit longer.
When you get to doing the procedure, you've spoken about having specific training and all of that stuff. Are there sometimes surprise elements that you find, or are you able to do with new technology all of the kind of looking into exactly what's happening underneath the layers of the skin, so you don't get to the operating table and, oh, surprise, you've also got to do this now?
Absolutely. I think there's always going to be surprises in theatre, and that's where the training comes in. So to do the straightforward procedure, a lot of people can do that, but when there's complications or where there's difficulties, that's where the specific training is important. It's difficult to assess pre-op, knowing exactly what you're going to find when you go in. Certain things that increase the difficulty or increase the risk of complications are, like we said, previous facelifts. Injectables, things like a Sculptra or fillers in the face as well, do increase difficulty. Before the procedure, obviously having a good examination, a good history, having an open and honest consultation with the patient prepares you for that. And preparation for the procedure is also improving the patient's comorbidities, so blood pressure, diabetes. Obviously, like we said, smokers aren't candidates for the procedure. Having all that optimized before surgery makes surgery easier and more predictable.
How does the cost compare to other facelift techniques?
So the cost in theatre is usually the amount of time that you're spending asleep or hospital charges with regards to that. Because we're talking about 3 to 4 to 5 hours, it is significantly more expensive than other facelifts. South Africa itself is cheaper than other countries. So certain countries like the UK can charge up to £30,000 for a deep plane facelift.
Wow.
Places like the US up to $200,000 for a facelift. So from a worldwide stage, we are better priced, and that's why we do have a lot of overseas people coming in for the procedure. It's cheaper for you to fly in, spend a few days here, have your procedure, and then fly back than actually having it in your home country. So in South Africa, we'd say up to 250,000 Rand for the procedure itself. And that's about an all-inclusive price. That's surgeon, hospital, anaesthetist, follow-ups. However, each patient is different. And that price is ultimately the number of procedures that you're going to have at one time and the time in theatre.
I want to talk a bit about the impact of social media. So now we've seen these pictures of Kris Jenner looking decades younger. And people think that this is just something that they can do, then they can also look like Kris Jenner. And social media does tend to give people a little bit of, I guess, body dysmorphia in like, oh, I don't look like that. I must do everything I can to look like that. So there's a psychological aspect as well.
Absolutely. It's really difficult, the situation that social media has put us in, because we're seeing a snapshot of, for example, Kris Jenner. She's looking amazing. But what we don't see is the decades of skincare routines, the regular facials and peels,
the money,
the money, the other procedures that she's had. So it does create body dysmorphia, and that's a problem that we are dealing with at the moment. So a lot of the times in our consultation, because we ask a lot of questions, you do get a feel of those patients that could be body dysmorphic. And those patients, unfortunately, no matter how many procedures you do, you won't improve their psychological state. So those sort of patients we try not operate on, although it's difficult to spot in advance sometimes. Unfortunately, with the way the world is going, we're seeing everyone on social media. This is how I want to look. The deep plane facelift is the answer, although it's not always the answer. It's one of the steps in that ultimate look that you're looking for.
Well, thank you so much for joining us this morning. Do I need to stop with the facial expressions? I don't know. Very concerned.
Maybe we're doing too much. We need to kind of be a little bit more stoic.
You guys are looking great. I don't think you need anything yet.
Thank you so much,
Thanks
Dr.
so much
Chris. What a pleasure.
Nou, dis alwaar ons nou tyd het, maar bly ingeskakel want net hierna gesels Rosanne met Karlien van Jaarsveld oor haar nuwe boek. Definitief 'n insiggewende gesprek wat wag, so ek is seker daarvan jy wil bly net waar jy is. Gaan maak sommer vir jou nog 'n koppie koffie of tee. Ons is nou weer terug.